The guidelines are really clear about how we should work in adult social care. So in terms of improving access for people, we can consider things like moving people experiencing homelessness up the waiting list. We can think about offering people more frequent and longer contact periods. And in terms of engagement, again, the guidance is really clear for us. We should be taking our service to those people. We should be going out to homeless day centres, to hostels, and sometimes even to the streets.
Traditionally, community mental health teams would send someone a letter and ask that person to come in at a time convenient for the team. Our patients, often if they're sleeping rough, they wouldn't get a letter. They might not have a mobile phone that works. They're not going to be able to make it to appointments, and it might not be their highest priority. So we'll take the service to them. We'll see people on the streets if necessary at their sleep site, or we'll make a place that's convenient for them, such as a day centre where we run clinics.
Well, you have to jump loads of hoops to get whatever. So maybe if it's for a family member, you have to prove where they're living, or you have to prove who they are. They have to have identification and address. Sometimes you get refused appointments because they haven't got an address, even though that's not the law. That's what happens. That shouldn't be happening. So I think everybody should be treated, no matter what.
I think that good practice is about adapting our ways of working to really think and consider the person that we're working with, to recognise that someone is likely to be fearful of meeting someone new, particularly someone in a position of power, and to be thinking about how we can make them feel safe and welcome, and to gradually build trust with someone, and to adapt the way we work in a flexible way and a creative way that meets their needs.
And we need to focus on building a relationship with that client, understanding their history, understanding their story, helping them with practical things, and thinking about the impact that trauma has on their recovery and their needs.
Trauma is incredibly relevant to our work because people who are experiencing homelessness have very often, nearly everyone has experienced traumas in the past. That might be forms of complex trauma growing up and experiencing forms of abuse and neglect, and later experiences of trauma in adulthood. It might affect people in terms of how they relate to others, so they will often and understandably be wary of forming new relationships.
I think doctors should talk to someone with care and compassion, and I think they should listen to what they've said and repeat back to them, and also not promise anything that they can't keep, and just be honest with them. And I think that's the best thing you can do, really.
Might be fearful of people who are in positions of power, and they might be reliving some of those really frightening experiences from their past.
Everybody in health and social care should be adhering to the NICE Guidelines. This guideline has taken 18 months to come about and is a result of rigorous evidence-based research and of experts in the field creating these guidelines.